Surgical innovation in many fields like orthopedics and cancer surgery have helped millions of people live longer and have better quality of life. However, surgery takes a toll on the body, and underlying factors can influence the recovery and the risk of having a complication. How strong and how fit someone is going into surgery has shown to have a significant impact on someone's survival and overall success of their procedure. As people get older in age, there is a natural decline in their muscle mass and their muscle strength. So this represents a major problem and risk factor in this older segment of the population that is more likely to need to undergo surgery. In this video, I review the science that demonstrates the critical importance of muscle mass, muscle strength, and cardiorespiratory fitness on its impact on the results of surgery. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in sports medicine and arthroscopic surgery. Prior to surgery, a healthcare professional can assess someone's muscle strength and their physical function to assess their post-surgical risk. For example, using surveys, we can ask patients how many blocks can they walk, how many flights of stairs they can climb, and this gives us a sense of their physical function. And there's an inverse relationship. If they have poor physical function, they're going to have higher risks after surgery. For example, there was a study of 600 consecutive patients who were referred to a medical clinic prior to having their surgery for pre-op clearance. And during this evaluation, they were asked these questions: how many blocks can you walk and how many flights of stairs you can climb? And so the researchers defined that if you could not walk more than 4 blocks or climb 2 flights of stairs, then that person was considered to have poor exercise tolerance. And they found that patients who reported poor exercise tolerance had double the risk of having a post-surgical complication, 20% versus just 10%. One of the problems with asking patients through a survey is that there is some recall bias. They may not remember exactly, or may either underestimate or overestimate their exercise tolerance with how many blocks or how many flights of stairs they can climb. So we want to look at also objective measures. There was a study that looked at 177 patients, 65 years and older, and they objectively tested them before surgery using a stationary bicycle. And what they defined was that if someone was not able to perform 2 minutes of the bicycle and raising their heart rate above 99 beats per minute, that was a predictor of having poor physical function and was a predictor for having postoperative complications. So what they found was that of the 108 patients who were able to achieve these exercise criteria, they only had about a 9% complication rate and only about a 1% risk of death. Now, in the patients, the 69 patients who were unable to meet this exercise threshold, cardiac or pulmonary complications occurred in about 42% and about 7% mortality rate. So huge difference here in those people who had poor exercise tolerance, meaning that those people who did not have good exercise tolerance or had good respiratory fitness were at a higher risk after surgery. And just as important as cardiorespiratory fitness and exercise tolerance is muscle strength and muscle mass. And here again, studies show this inverse relationship. Those people who have low muscle mass or muscle strength have a higher risk of postoperative complications. Now, in older people who have loss of muscle mass or muscle strength, we call this sarcopenia. And there was a study that was performed at Johns Hopkins, and what they did was they used a CT scan within 90 days before surgery, and this was surgery for colorectal surgery or pancreas surgery or hepatobiliary surgery. And what they found was that about 25% of those patients had sarcopenia. And when they compared those patients with sarcopenia to those who did not have sarcopenia, they noticed significant differences. So the risk for a postoperative complication was 26 or 27% in those people who had sarcopenia versus only 18% in those who did not. So a dramatic difference in the risk of postoperative complication. As you can imagine, if people have more complications, their cost of healthcare is going to go up. And so this study found that those patients who had sarcopenia, on average, there was about a $14,000 increased cost for their healthcare. And nowadays, many patients have to bear the brunt of increased medical costs, so that's significant. Now, in addition to postoperative complications and the cost of postoperative complications, postoperative mortality, the risk of death, was 4 times higher in those patients who had sarcopenia compared to those who did not. This is a significantly increased risk, and so it's very important that older patients maintain their muscle mass and muscle strength. Muscle mass or muscle strength is really on a spectrum. So it's not just that if someone falls below a certain threshold or higher threshold, it's graded. And studies have shown this, that as people have worse and worse muscle strength, that their risk goes up in a graded fashion. So there was a study of about 1,400 people who had received, again, a CT scan prior to elective general or vascular surgery, and that they found in this graded fashion that those people who were in the lowest third of muscle mass had about a 21% risk of a postoperative complication. Those who were in the middle third of muscle mass had only a 15% risk, and those who had the most muscle only had about a 12% risk. So again, this shows this graded increased risk of postoperative complications based upon how much muscle mass. Now, they also similarly found a graded increase in cost. One of the most concerning postoperative complications is a postoperative infection. And interestingly, age and sarcopenia work together to make this risk even greater. For example, there was a study of about 234 patients who were undergoing primary colorectal cancer resection. And again, before surgery, they had a CT scan to evaluate, did they have sarcopenia? And so what this study found was that the risk for infection was greater for those people who had sarcopenia. It was 23% in sarcopenic patients versus only 12% in those people who did not have sarcopenia. However, in those patients who are over 65 years old, if they had sarcopenia, their risk for a postoperative infection was 30% versus only about 9% in those older patients who did not have sarcopenia. Post-surgical survival, and studies have looked also specifically at cancer post-surgical survival, is significantly impacted by sarcopenia. Although sarcopenia affects mortality to different degrees in different cancer surgery, overall it seems pretty consistent to have an impact. After surgery, you want to hopefully recover as quickly as you can so you can get out of the hospital and do the rest of your recuperation at home. Nobody wants to get stuck in the hospital. Staying in the hospital for extended periods of time open you up to other risks like infection and other complications. However, having sarcopenia or poor fitness or function puts those people at risk for not being able to get out of the hospital quickly. Now, studies show that patients with sarcopenia are more likely to be stuck in the hospital longer. For example, there was one study that we had discussed previously that had included over 1,000 patients undergoing major abdominal operations, and that they reported that the median length of stay for those patients who had sarcopenia was 9 days versus 7 days in those people who did not have sarcopenia. Then there was another study that looked at those people who were undergoing colorectal cancer, and they found that in those patients who were over 65 years old, those sarcopenic patients had a length of stay of almost 16 days compared to just 12 days in those people who did not have sarcopenia. Additionally, patients with sarcopenia required more assistance with inpatient rehabilitation, again driving up their costs and medical bills. And they found that in sarcopenic patients, about 24% needed this extra inpatient rehabilitation versus just 11% in those who do not have sarcopenia. Let's wrap up this video and go over a few key points. Number 1, low muscle mass and weakness are major risk factors for complications after surgery. Number 2, poor aerobic function, such as difficulty walking blocks or walking up flights of stairs, is associated with post-surgical complications and increased mortality after surgery. And number 3, maintaining a physically active lifestyle, which includes aerobic exercise to help with cardiorespiratory fitness and resistance training to improve muscle strength and muscle mass, are very important to help reduce the risk for those older people who are going to need surgery and help improve longevity. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. Thank you for watching this video. I look forward to seeing you in my next video or in my office.